morning, Puneet. How are you today?
I'm good. How are you?
I'm good. I'm Jaya. I'll be a nurse practitioner today.
Okay.
What brings you to the clinic today?
I need to get a physical done.
Okay, so we are going to do a detailed head to toe physical for you today.
Mm-hmm.
If you have any other concerns, let me know.
Okay.
Did you empty your bladder?
Yes.
Okay. And then while she came in, we did do her vitals, her BP, heart rate, temperature, respirations, pain assessment, which was all okay, and also her height and weight. So now we're gonna get started with the assessment. I'm gonna start with the head and then we'll go down, okay?
Okay.
Palpating the head for any tenderness. Do you feel any pain?
Mm-mm.
Have you had any head injuries?
No.
There's no nodules, no bumps. The hair looks nice, black, thick and coarse. No dandruff or anything. Okay, so next we will do your eye examination. So do you have any problem with eyesight? Do you use glasses?
Mm-mm.
Okay, we're gonna check optic nerve too, so I'm gonna check your visual acuity. I'll have you read the smallest possible line on the chart there.
LTFPH.
Okay, and so that is 20 by 20. You have good vision. We're gonna test your near vision.
Mm-hmm.
So I'll have you read the smallest line on this one.
ORZSK.
Okay, good. That's also 20 by 20. So your visual acuity is good. We're gonna now check the visual fields. So I'll have you cover one eye, and then with the other eye, I'm gonna show my fingers. Tell me when you can see them.
Do I look forward?
Look at me. Yeah, don't look on the side.
Okay.
Tell me when you see my fingers.
I can see them.
Okay.
I can see them. I can see them. I can see them.
Okay, let's do it with the other eye.
Yeah, I can see them. Mm-hmm. I can't see them. I can see them.
Okay, so that was testing your visual field, and that also appears to be normal. So next, so your optic nerves are intact. Next, we're gonna test the oculomotor nerve.
Mm-hmm.
So I'm gonna check for pupillary reaction to light. I'll have you look forward,
Mm-hmm.
focus in front, and I'm gonna shine this light in your eyes, okay?
Okay.
Okay, well, good constriction. Good constriction. So pupillary constriction is equal and reactive on both sides. I will also test the oculomotor abducens and trochlear nerves. So we will do another test, that is the cardinal fields of gaze.
Mm-hmm.
So I'll have you look at this, and then only with your eyes follow my finger.
Which finger? This one?
This finger.
Okay.
Okay, good. And there was no nystagmus present, so cranial nerve 3, 4, and 6 are intact. Next, we will check. I'm gonna do a fundoscopy exam for your eyes. So I'll have you look straight ahead, and I'm going to look for the red reflex in your eyes. Keep your eyes open and focus in front. Keep your eyes in front.
Sorry.
Hold on. Okay, keep looking in front.
Okay.
Okay, I do see the red reflex. And I see the fundus there. I'm going to do it on the other eye. Keep looking in front. Okay, see the red reflex. Okay, fundus and the blood vessels look good, intact, no problems. Next, we will check your, let's do the ears first. So I'm gonna check acoustic nerve 8. I'm gonna say some words, I'll have you repeat them.
Okay.
Today is Sunday.
Today is Sunday.
Okay, so that is the whisper test. 7, 8, 9.
7, 8, 9.
Okay, good. Your hearing is good. I will also do some other tests for your hearing. So this was the Weber test. I'm going to put it on the center of your head and let me know in which ear you can hear it first or if you can hear it equal.
Okay.
Can you hear it? Oh. Okay. Can you hear it now?
I can hear them both.
Okay. I'm going to do the Renee test now. So I will put this again behind your ear and then in front of your ear. Tell me when you stop hearing the sound, okay?
Okay. I don't hear it anymore.
Can you hear it?
Mm-hmm.
Tell me when it stops.
Okay.
And that's testing for bone and air conduction. Air conduction should be twice as long as bone. You're gonna repeat it on your other ear.
I can hear it.
Tell me when it stops.
It stopped. I can't hear it.
Okay, so bone conduction is, air conduction is twice as fast as bone. I'm going to now look into your ears. Do you feel any pain in your external ear when I pop it? Okay. I'm going to look inside. I see the gray tympanic membranes and the cone of light. Your canals are clear with no obstruction, no redness, and no cerumen.
The wax?
Yeah.
Oh, I cleaned it.
Okay, good. I see the gray tympanic membrane and the cone of light. No bulging and the tympanic is intact. Good, so everything looks good so far. Now we're gonna do the test your nose, look at your nose.
Okay.
So do you have any problems with cold or obstruction in your nose?
Mm-hmm.
I'm gonna have you smell something.
Mm-hmm.
Close your eyes for me. Close one nostril. And can you tell me what you smell? That's testing for olfactory nerve, cranial nerve 1.
Lavender.
Okay, good. And with the other nostril,
This one? Like this? Or like this?
close the other one. Yeah. Tell me what you smell.
It's like a lemon.
Okay,
grass.
good. So olfactory nerve intact. Can you again close your one nostril and take a deep breath? Any difficulty breathing? The other one?
Okay.
Okay. I'm going to look for inside your nostrils, okay, for any obstruction or septal deviation. So if you can tilt your head back. It looks nice and pink, moist, turbinates with no swelling, and the septum appears midline.
Sorry, I have a nose piercing.
It looks good, pink, moist. Septum is midline. Okay, so
Okay.
you're okay?
Yeah.
Okay,
It just,
so
you know, makes your eyes water.
next, I'm just going to check your sinuses. So do you feel any tenderness here in your frontal sinus, ethmoidal sinus, maxillary sinus? Okay, and next I'm gonna check your muscle function of the face. Okay, so we're checking cranial nerve 7, the facial nerve. I'll have you raise your eyebrows, close your eyes shut. Can you puff up your cheeks? Can you blow through your mouth? Okay, good. I'm also going to check the TMJ at the same time. That is checking trigeminal nerve. So do you have any pain here? Can you open your mouth? Close. Can you put your jaw side to side? Okay. No popping or clicking. TMJ is strong. I'll also test for some sensations. So I'm gonna have you close your eyes, and I'll poke you with this, sharp or blunt. Let me know if you feel it. Okay.
Okay.
So do you feel sharp or blunt?
Sharp. Sharp. Blunt. Sharp. Blunt. Sharp.
Okay, good. So trigeminal nerve is intact. Next, I'm going to check the inside of your mouth. So if you can open your mouth wide for me. And can you say ah? Okay. The uvula did move, and that indicates the vagus nerve is intact. I am going to defer the gag reflex. We'll test the swallowing though later. So let me just check your mucosa again. Can you put your tongue out? The oral mucosa looks intact. Teeth are intact, no caries. Gums appear healthy. Tongue appears fine. You can close the pharyngeal and tonsils look nice, pink and moist. No signs of infection, no exudate present. So I will do another test for your tongue movement. That is testing cranial nerve 12, the hypoglossal. So can you take your tongue out, move it side to side? Can you put it against your cheek and okay, this side? So hypoglossal is intact. I will also test for taste. So that is another test for the glossopharyngeal. Can you open your tongue and tell me what you taste? Just salty, sweet, sour, whatever.
I think it's kind of salty. Or is it sweet?
That it is sweet, but it's okay. Maybe we have to do further testing for that. So that was testing the glossopharyngeal too. So with that, your cranial nerves 1 to 12 are grossly intact. I am going to check for your lymph nodes now. So we'll start with the occipital, then post-auricular. Tell me if you feel any tenderness. Pre-auricular, parotid, submandibular, and submantle. No nodes are felt. And we're gonna do the posterior cervical, and then the anterior cervical, and then the supraclavicle and inferior clavicle. No tenderness, and I don't feel any enlargement. So your lymph nodes are good. Next, we are going to check your neck. So on inspection, the neck looks okay. There's no thyroid enlargement seen. I don't see any jugular venous distension. The trachea appears central. So I will, I'm going to have you take a sip of water and I will check, hold it in your mouth. And I'm gonna check for the thyroid. Can you swallow it now? Okay, do it again. I'm gonna check this side.
Oh, sorry.
Oh.
Sorry.
Hold the sip. Okay, swallow. Okay, I feel the thyroid smooth with no nodules, and her swallowing is good, so that again confirms the glossopharyngeal and vagus nerve is intact. Next I'm gonna do the back. So can you put your hair in front? Oh, okay, one more thing. Before we do that, I'm gonna check the spinal accessory muscles. So can you raise your shoulders? Okay, good. Can you turn your head that side? This side? So spinal nerve, spinal accessory cranial nerve 11 is intact. Do you have any problem with your neck movements?
Mm-mm.
Okay. Can you bend it forward? No, just the neck.
Oh.
Front, back, side to side. Okay. Range of motion in the cervical region is intact. So if you can face that side for me.
This way?
Yeah. I will, I'm gonna check your lung sounds.
Okay.
So first I'm going to just palpate and I'll have you say 99 whenever I touch your back.
Okay. 99. 99. 99.
Okay, good. So tactile fremitus is present. While palpating, I didn't feel any nodes or any abnormality there. So next I'm going to percuss. I will use this. Good resonant sounds are present. Okay. I'm gonna have you breathe. Take a deep breath as big as you can. Okay, there's good diaphragmatic expression. I'm gonna check diaphragmatic excursion another way. So I'll have you take a deep breath and hold. Can you hold it? Now mark that. Okay, can you take a deep breath again and exhale as far as you can. And this is 3 centimeter, which is normal. So good diaphragmatic expression. Also, as I'm doing my palpation and percussion, I don't see any use of accessory muscles or any labored breathing present. And while we're doing the back, I'm also going to check the costovertebral angle for any tenderness. So let me know if you feel any pain. Do you feel any tenderness? Any?
No.
Okay, so no tenderness in the costovertebral angle. Also, can you stand up now? I'm just going to check for range of motion of the spine. So if you can bend forward.
Touch the ground?
As much as you can. Yeah, you can. So that I don't see any spinal curvature, no scoliosis. Okay. Can you bend back as much as you can? Okay, good, good. So there's good range of motion and no problem with the thoracic spine. You can have a seat.
Sorry.
So we will do the.
Should I face this one?
Okay, that's fine. So I'm going to again palpate and let me know if you. I mean, set 99.
Okay, 99, 99, 99.
Okay, tactile firmness is present. I'm going to again do the percussion.
Sorry. Just
Okay. Okay. Can you lift your hands up? Okay. Okay, good. Good resonance sounds bilaterally equal. I'm now going to auscultate for breath sounds. If you can turn that side again. I'll have you take deep breaths, okay?
Okay.
Take a deep breath. Okay, I'm gonna auscultate your breath sounds here. Deep breath. Bilateral breath sounds are good and equal. No wheezing, ronchi, or crackles noted. So next I will have you lie down. Oh no, hold on. Sit face me, and then we'll do it lying down. So I'm going to check next to your heart. The lungs appear to be good. We're going to palpate for the PMI. I don't feel the PMI, no heaves or thrills. I'm going to palpate for any other abnormal breath sounds. No heaves or thrills. Okay. Next I'm going to auscultate. So aortic. Can you take a deep breath and hold? Okay. Pulmonic. Breathe. Second pulmonic or Erb's point. Tricuspid. And mitral. So S1 and S2 heard loud in all regions, and there are no abnormal murmurs or gallops heard. I'm going to check your heart again as you're lying down. Up. You want to speak up a little? So aortic again. We'll do it with the bell. Pulmonic. Tricuspid. And mitral. Okay. And as I'm checking the PMI, I'm also going to, as I'm auscultating, I'm going to also check for the carotid pulse. And they're both synchronous. Okay, so that is good. Next, I'm going to check your abdomen. Okay, so we'll put this up a little. on inspection, the abdomen looks symmetrical. I don't see any bulging, no nodules, no bluish discoloration, nor the rash or redness over the abdomen. Can you lift your head a little? And I don't see any herniation with increased pressure on the abdomen. Next, I'm going to auscultate. So we're gonna first auscultate the bowel sounds. And that's in all 4 quadrants. I can hear bowel sounds in all 4 quadrants. I'm gonna auscultate the epigastric region for a venous hum. And then the umbilicus. No venous hum noted. Next, I'm going to auscultate the aorta. No bruit present. The renal arteries. No bruit. Iliac artery. And the femoral artery. There's no bruit present in either of those. So next we are going to do percussion. So I hear tympanic and dull sounds. I'm going to percuss the liver for any friction rub. None present, and the spleen, none present. I'm also going to percuss to find the liver margins. So I'm gonna start there, dull. Hold on, let me do it again. And this is about 4 centimeter, which is normal. So there's no liver enlargement. Next, I'm going to palpate. So let me know if you feel any pain.
Tickles.
Any pain? And I don't feel any lumps or bumps or any masses. Okay, I'm gonna do a little deeper palpation. Let me know if it hurts.
Tickles.
Just tickles.
Yeah.
So no pain?
No.
Okay, I have to go a little more deeper, okay?
Okay. I don't know why it tickles
Okay.
so much.
So any pain? Do you feel any pain anywhere?
No.
Row 6 sign is negative, and then okay, try and take a deep breath. Okay, there. Can you take a deep breath?
Okay.
Breathe out. Any pain?
No, it just
Okay,
tickles.
just tickly, that's okay. Some people do have more than usual. So next I'm going to palpate the liver. Can you relax?
Okay, sorry.
Take a deep breath. Okay, I don't feel the liver. It's okay, I'm not supposed to feel it.
Oh, okay. I thought that meant-
Take a deep breath. Breathe out. Okay.
Do you feel the kidney?
No, that was trying the spleen. Okay, take a deep breath. Breathe out. No, I don't feel it. Next, I'll do the kidney.
Okay.
So deep breath again. Breathe out. Not palpable. Deep breath again. Breathe out. No, so kidneys are not palpable, and that is all normal. That's what we want.
Okay.
There's no tenderness anywhere, and yeah, we already said McBurney's and Rosexan was negative, so that was good. Now next we will test your cerebral function and proprioception. So do you want to have a seat? I'm going to have you stand up, and if you can walk back and forth. Gait is steady, normal. Can you walk on your tippy toes?
Like from here to there?
Yeah. So she has good balance. Okay. Can you walk on your heels?
Like this?
Yeah. Okay. So good balance. If you can stand here, keep your feet together. Okay. Now close your eyes and stand. Okay. Romberg is negative. She didn't have any swing. That's good. So I'll have you sit back on the chair. So I'm going to test for fine motor coordination. I'll have you close your eyes. Before you close, see what you have to do. Put your hands and touch your nose in succession. So you can do it as fast as you can. Okay, good. Can you pat your hands as fast as you can? Okay, that's good motor coordination. And then I'll have you touch your nose and then touch my finger. No, continue to do it.
Oh.
Okay, that's good. So fine motor coordination seems okay. Can you close your eyes again? Can tell me what this is?
A quarter?
Yes. So a good stereognosis. I'll have you close your eyes again and tell me what I wrote on your hand.
An 8.
Okay, so
Yeah.
that was checking for graphesthesia, and that's intact. Next I'm going to check your reflexes. So we're gonna start with the hand. That's the brachial. Okay. Brachioradial. Okay. And triceps. And these all check the cervical, sorry, hold on. They all check the cervical there. Okay, good. Cervical spine. Now we'll do the same on this side. Okay, that's good. Next we will check the patellar reflex, which tells us about the lumbar, thoracic and lumbar spine. Oh, hyperextension. Those are hyperreflexes, but it's okay. And then we'll check the plantar reflex.
Hopefully I don't kick you in the face. Ah, it tickles!
Okay, good. Okay, good. And the Achilles. Okay. and those are to check S1, L12 and S1, S2 radiculopathies. So those were all good. And with that, we are done with the head-to-toe assessment. Everything looks good. Thank you for being here today.
Thank you.